Pharmacology is derived from the Greek word that is pharmakon, which is active principle, and logos, which means discourse. Okay, pharmacology is a science that deals with the study of drugs. Now, we have to know about the definition of drug. In a broad sense, drug can be defined as a chemical substance that is used for the treatment, prevention, or diagnosis of disease. Okay, drug is any chemical substance. Where it is used either for the treatment or for prevention. That means prevention means does not, if the drug is taken, the drug will not cause the or will not allow to develop the disease. Okay, and for diagnosis of disease. These three are the major use of the substances which we are going to call them as a drug. Okay, drug in a broad sense can be defined as a chemical substance that is used for treatment, prevention, and diagnosis of disease. Now, according to WHO, that is World Health Organization, drug is defined as any substance or product that is used or intended to be used. That means either taken self or someone has suggested, especially the physician, intended to be used to modify or explore the physiological system or pathological state for the benefit of patients. Okay, now when we require exploration of physiological system in hormonal deficiencies, what is going to happen? Hormonal replacement therapy will be given. Okay, here the hormonal replacement therapy is a drug or the substance which will explore the physiological system. Okay, who is that? In certain pathological states also, the drugs are given for the benefit of patient. Now, whenever we are defining any any definition here, in the third paragraph, we have said that this definition is according to WHO. Whenever we are defining the definition of a particular thing, then we should not alter. Here, we should not alter the definition of drug. Okay, whenever you write about the definition of drug, then you have to say like this: any substance or a product that is used or intended to be used to modify or explore the physiological system or the pathological state for the benefit of patient. Okay, this is the definition of drug according to WHO. Okay, World Health Organization. Now pharmacology is a vast subject. We cannot study pharmacology in a single sentence or in single manner. So pharmacology will be divided into two main headings, that is pharmacokinetics and pharmacodynamics. Okay, throughout our pharmacology, whenever we learn about the drugs will be learned under two side headings, that is pharmacokinetics and pharmacodynamics. Clear? Pharmacokinetics means absorption of the drug, distribution of the drug, metabolism of the drug, and elimination of the drug. These are the again four side headings of pharmacokinetics. These are the four main side headings to learn the pharmacokinetics. Pharmacokinetics will be learned under four side headings, that is absorption, distribution, metabolism, and elimination or excretion. Okay, In simple, we can abbreviate them as ADME. That is absorption, distribution, metabolism, and elimination or excretion. Okay, under these four headings, we are going to study about the pharmacokinetics. Okay, now next one is pharmacodynamics. In pharmacodynamics, what we are going to learn is mechanism of action of the drug. Now, let's take the painkiller, any painkiller, analgesic drug. Now, how this drug is producing analgesic effect, that is mechanism of action. Apart from the mechanism of action, if this drug has got other actions on the other systems of our body, then these are called as pharmacological actions. Or in if this grade of this pharmacological action is increased, it may cause adverse effects, side effects. Okay, pharmacology will be studied under two side headings. One is pharmacokinetics and another is pharmacodynamics. In pharmacokinetics, again, we have four subdivisions to learn the pharmacokinetics. That is absorption, distribution, metabolism, elimination. And pharmacodynamics means, in pharmacodynamics, we are going to learn about the mechanism of action and pharmacological actions, that is action of the drug on the other systems of the body. Okay, now if we take any let's take the digoxin is the drug which is used in the congestive cardiac failure. So its mechanism of action is it acts on the sodium potassium ATPase, which is present on the cardiac muscle cells. Okay, now apart from this digoxin also acts on the other systems of the body. Action of the drug apart from the site of action is called as pharmacological actions. Okay, now here in this slide I have said about, I have mentioned concentration in plasma, concentration at site of action. Okay, theoretically, not theoretically, hypothetically, when the drug is taken, let's assume that when the drug is taken orally, once it reaches into the GIT, this drug will enter into the systemic circulation. Okay, how it will enter? It will enter from the GIT cells to the blood. Okay, here once it reaches into the systemic circulation, the drug will distribute throughout the body. Okay, this is hypothetical distribution, that is concentration of the drug that enters into the plasma and gets distributed throughout the body. Okay, now for here, remember two things. Pharmacology will be studied under two side headings, that is pharmacokinetics and pharmacodynamics. In pharmacokinetics, what we are going to study again? We are going to study about the absorption of the drugs, distribution of the drug, metabolism of the drug, and elimination of the drug. And the next side heading of the drug is next side heading of for learning pharmacology is pharmacodynamics. Okay, in pharmacodynamics, what we are going to learn is we are going to learn about the mechanism of action and pharmacological actions of the drug. Okay, now let's go to the next slide. Pharmacokinetics. Pharmaco means drug. Kinetics means movement. It is movement of the drug from site of administration. If you have taken the drug orally from the mouth, where this drug is moving, how it is moving, okay, how it is entering into the systemic circulation, how it is going to get metabolized. Once it is metabolized, how it is going to get excreted. That one we are going to study under side heading of pharmacokinetics. Okay, that is the movement of the drug from the site of administration to the elimination of the drug from the body. Okay, why elimination? Because most of the drugs are the foreign substances. When we take the drug, this drug will enter into the systemic circulation. Entering of the drug into systemic circulation is called as absorption. Once it enter into the systemic circulation, it will gets distributed throughout the body. It is called as distribution. Okay, once distribution is over, the drug will get metabolized. Okay, once the drug is metabolized, this metabolic products or end products of the drug will get excreted. And how it is going to excreted, we are going to learn under this identity called as excretion or elimination of the drug. Okay, this is what we will learn in pharmacokinetics. Okay, now in simple way, what we can say about pharmacokinetics means what the body does to the drug. Okay, I will repeat again. Pharmacokinetics means what the body does to the drug. Now, just everyone read the pharmacokinetics uh, pharmacokinetics definition here. Pharmacokinetics means it's a study of absorption. Okay, how absorption is occurring and how the drug is going to get distributed and how the drug is going to get metabolized and how the drug is going to get excreted. These are the four things we are going to learn under pharmacokinetics. How these four things are happening? These four things are happening because of action of the body. So that's why in simply pharmacokinetics means what the body does to the drug. Okay, now next one, pharmacodynamics. Dynamics means power or action. Okay, drug action or drug power. Okay, it deals with the biological and therapeutic effect of drugs, including mechanism of drug action. Okay, as I said earlier, what we are going to learn in pharmacodynamics? In pharmacodynamics, we are going to learn about the drug mechanism of action and its pharmacological actions. Okay, mechanism of action means drug action at the required site. Pharmacological action means drug action in the other sites of the body. Okay, clear? Mechanism of action is the action of the drug at the required site. Pharmacological action means the action of the drug on the other systems. Okay, okay. Now, let's take the example. Let's take the patient has got peptic ulcers. Okay, patient has got problem of ulcers. For the treatment of ulcers, what we will give? Proton pump inhibitors will be given. Now, proton pump inhibitors will act on the parietal cells of stomach. Parietal cells of the stomach are the site of actions for mechanism of action. Okay. Now, whatever the proton pump inhibitors that do on the cardiovascular system, whatever the proton pump inhibitors that do on the respiratory system, whatever the proton pump inhibitors do on skeletal muscles, cardiac muscles, or on other sites, on other system, whatever this drug that do or that show actions on the other systems are pharmacological actions. Okay, the proton pump inhibitor action on the parietal cells is mechanism of action or site of action, site of desired effect. Okay, now apart from these two, we also have to learn few terms in pharmacology where we will come across throughout our pharmacology. In this, the first one is therapeutics. Now, what is this therapeutics? It's a branch of medicine concerned with prevention and cure of disease or relief of symptoms. Okay, therapeutics means it's a branch of medicine concerned with the prevention and cure of disease or relief of symptoms. And the next term is chemotherapy. Okay, here this chemotherapy deals with the treatment of infectious diseases. Infectious diseases means the disease caused by the microorganisms. Okay, okay. Now, if we take this COVID-19 coronavirus, which also called COVID-19 is a infectious disease caused by SARS-CoV. Okay, like this. Cancer is again another type of disease, and this one occurs due to mutation in the chip. Okay, mutation in the DNA of a particular cells causes cancer. Okay, chemotherapy deals with the treatment of infectious disease, and it also deals with the treatment of cancer. Okay, with chemical compounds that have a relative selective toxicity for infecting organisms and cancer cells. Okay, chemotherapy deals with the treatment of infectious disease and cancer, with a chemical compound or simply it's a drug with a chemical compound that has got selective action. That means it will show actions on that infectious microorganisms or on the cancer cells only. It does not affect any human normal cells. Human cells or normal cells. Okay, these compounds selectively inhibit the infectious microorganisms and cancer cells. The next term is pharmacy. Is the art and science of preparation, compounding, and dispensing for the purpose of administration to the patient. Okay, nowadays the pharmaceutical companies are preparing and pharmacy people are holding these drugs. Whereas before, these people, pharmacy people, used to prepare the drug according to the concentration suggested by the physician. Okay, okay. Immediately, whenever the physician write the drug or specifies the drug name and concentration, the pharmacist what he will do means he will prepare the drug at the specified concentration by the physician. Okay. Now, next term is clinical pharmacology. Clinical pharmacology. It is the study of evaluation of a pharmacokinetic, pharmacodynamic, pharmacodynamic data, safety, efficacy, adverse effect of a drug by comparative clinical trials in healthy volunteers and in patients. Okay, whenever the new drug is brought, then this new drug will undergo or the clinical pharmacological data of this new drug should be shown. Then only the drug will be released into the market. Now, in this current situation for COVID-19, if we take the drug favipiravir, which is called as Febiflu, which comes under the brand name of Febiflu, and the generic name of the drug is Favipiravir. Okay, now this drug should show promising pharmacokinetic information, pharmacodynamic information. It has to show the safety, and it also has to show its efficacy, and if any adverse effects are there. These adverse effects are risk reward ratio will be evaluated for any drug before releasing into the market. Okay, these all information is gathered from the clinical trials. Okay, where it is conducted? It is conducted in the human volunteers, that is in healthy human volunteers as well as in the patients. Okay, now this is about the clinical pharmacology. The next one is toxicology. Toxicology is a study of poisons, their actions, detection, prevention, and treatment of poison. Okay, toxicology is the study of poisons, their actions, detection, prevention, and treatment of poison. Okay, these are the terms. Sorry, these are the terms which you have to learn in your pharmacology, where you will come across all these terms in throughout your pharmacology. Now, next one is source of drugs. Now, from where these drugs are produced, from where these medicines are produced. First is alkaloid, or the alkaloid means I will explain the or define the alkaloid, then I will explain the source. Alkaloid means it's a basic nitrogenous heterocyclic basis of plant origin. From where it is produced? It is produced from the plant. What is its chemistry? It's a basic in nature and it has got nitrogenous heterocyclic basis. It is the chemistry of the alkaloid. Source is plant, chemistry is, these are the bases which has got nitrogenous heterocyclic basis and produce salt when it combined with the acid. When the alkaloids are combined with the acid, it will form as a salts and are pharmacologically active principle of plant. These are the active principles produced from the plants, not from all, from specified plants. And coming to its other nature, these compounds are insoluble in water, whereas these compounds when combined with the acids, it will form salts, and these salts are soluble in water. Okay, an example of alkaloid, atropine, which is obtained from the Atropa belladonna. The next one is, next example for alkaloid is quinine, which is obtained from cinchona bark. The next example is morphine, which is obtained from Papaver somniferum. And the next one is reserpine, which is obtained from Revolvia serpentina. The next one is nicotine, which is obtained from the tobacco leaves. If you see the examples in this slide on the right side of here, if you see here, these all are plants. Okay, these are all are alkaloids which are obtained from these plants. Okay, so and one more thing is there. If you observe the name of all these alkaloids ends with INE. So this one is the simple way to remember whether the compound is alkaloid or not. 99%, I won't say 100%, 99% of alkaloids ends with INE. Okay, now we'll go to the next slide. Next one is glycosidic drugs or glycosides. Now, these are also obtained from the plants. Don't get confused. Glycosides and alkaloids both are obtained from plants. but their chemistry is different. In alkaloids, they have nitrogenous bases. Here, the glycosides has got two compounds. One is sugar moiety, another is non-sugar moiety. And these two compounds are combined together by the ether linkage. If you see here, this one is the ether linkage, which helps in binding the sugar moiety with the non-sugar moiety. And the example of glycosides are digoxin and uh, one more antibiotic is amino glycosides. These are the substances which has got sugar and a non-sugar moiety in their structure. Next one is oils. These are the liquids which are insoluble in water and highly viscous. We have three types of oils are there which are sourced for the drugs, and those include fixed oils, essential oils, and mineral oils. Now coming to the fixed oils, these are the solvents which are extracted by crushing the seeds. Okay, and coming to its properties, these are non-volatile. That means these fixed oils does not get evaporated. And coming to its another property, it has got caloric or food value is present for the fixed oils, and these will form soaps, in form of soaps, and these are also used as a purgatives and demulcents. And example for the fixed oils are castor oil, groundnut oil, and coconut oil. Purgatives means which are used in the treatment of constipation. You will come across the purgatives in GIT. And demulcents means these are the soothing agents, or which will form a layer on the irritated region of throat. Mainly used demulcents are used for irritation of throat. And the next one is essential oils. These are the volatile oils. These are produced by steam distillation of leaves and flower petals. Okay, coming to its property, it is volatile. That means this will get evaporated, and this essential oils does not have got any caloric or food value, and these compounds do not form soap or rancid, and these are used as a astringents, carminatives, and flavoring agents. Okay, essential oils are used as flavoring agents or carminatives and astringents. Astringent means it's a chemical which will precipitate the mucosal proteins, and mainly astringents are used for bleeding gums. Coming to the examples of essential oils, clove oil, eucalyptus oil, and peppermint oil. And eucalyptus and peppermint oil are mainly used as a flavoring agents. The next type of oil is mineral oil. They are petroleum products obtained by dry distillation of wood, and these compounds has got no food value. If if the oil does not have got any food value, then it will not get destroyed. Used as a vehicle for preparation of ointments, and the example is hard and soft paraffin and liquid paraffin. Liquid paraffin, apart from using as a vehicle, it is also used as a purgative agent for treatment of constipation. The next one is tannins. Tannins are the non-nitrogenous phenolic derivatives from the plants. These are also obtained from the plants, but its chemistry is these are non-nitrogenous phenolic derivatives. And tannins are mainly used as astringent. And the examples of tannins are tincture catechu and tincture tuba. The next one is gums and mucilage. And gums one second, one second. Gums is rapidly dissolved in water. These are the pathological products which are produced from the plants. Okay. Examples is agar and some emulsifying gum cassia, which is used as a emulsifying agent. Agar and psyllium seeds, which are used as a laxative agents in constipation. The next one is mucilage forms a slimy mass which is a physiological product, not produced because of infection or because of disease. These are the physiological products of the plants. And the example is ragacan, which is used as a emulsifying agent. And next one is resins. These are the solid substances which are again obtained from the plants, produced by oxidation and polymerization of volatile oils. The next compound is antibiotics, which are mainly produced from the microorganisms. Chemical substances produced or derived from living cells which have lethal or inhibitory action on microorganisms. Remember, these are produced from the microorganisms, acts against another microorganisms. Okay, nowadays all the chemotherapeutic agents which are used for infectious diseases are called as antibiotics, but it's not right definition. Right definition for the antibiotic is the substance which is produced by the microorganism and which show action against the other microorganisms. The source of antibiotics here, for example, is bacteria and molds. The next one is hormones, which are produced by the specialized chemicals. Hormones are the specialized chemicals generally derived from the animal endocrine glands. The example is insulin, sex hormones, corticosteroids, and thyroxine. So, from plants, what are the parts which help in drug production is roots. From the roots, reserpine is produced. From the bark, quinine is produced. From the leaves, digoxin, digitoxin, and atropine is produced. From the flowers, thymol, rosewater, and from the seeds, castor oil. From the fruits, morphine, and from the exudates, gum acacia and gum ragacan are produced. All these are produced from the plant sources. Okay, when you progress in your second year pharmacology, at certain time, most of you people say that alkaloids are only natural, alkaloids are plant sources. Not only alkaloids, we have other substances like tannin, resins, oils. These are also obtained from the plants only. Okay, don't get confused. Now, animal sources, vitamin A is produced from the liver of codfish, and insulin is produced from the pork and beef. Thyroxine is produced from the thyroid glands. Vaccines are produced, and antitoxicina is produced, and from minerals, iron, which is used in the treatment of anemia, iodine, goiter, gold, arthritis, magnesium trisilicate, hyperacidity, and peptic ulcer, and aluminum trisilicate diet. Okay, and these are the microorganism source. With this, we have completed the introduction of pharmacology and source of drugs. Clear? In less than 1 minute, it is going to end. Is it clear?